Welcome to TCN Talks. The goal of our podcast is to provide concise and relevant information for busy hospice and palliative care leaders and staff. We understand your busy schedules and believe that brevity signals respect. And now, here's our host, Chris Como.
Hello and welcome. Our guest today is Mark Cohen. This is definitely starting to become my favorite time of the month. Mark and I are going to cover the top news stories of the month for May 2023. Welcome, Mark. Good to have you.
Hey, Chris. Good morning. Nice to see you.
Yeah, nice to see you too. Mark, why don't you tell our audience something new maybe they have not known about you?
Well, before I got involved in healthcare, starting with hospitals, my last job was vice president of public affairs for Citibank's consumer bank in Florida, which at the time was a mid-size bank by Florida standards. My portfolio included media relations, internal communications, special events, public affairs and lobbying, and corporate philanthropy. In many ways, the grant making was the best part of the job. We were a mid-sized bank. But I had a relatively generous annual budget of $750,000 a year for corporate contributions. And it was a time when Citibank was evolving its corporate philanthropy, moving from a philosophy of letting local bank leadership fund whatever the heck they wanted to one where the consumer bank was focusing almost exclusively on K through 12 education and community development. So it was an opportunity for me both to extricate the Florida Consumer Bank from a number of unproductive donor relationships, some of which were longstanding, frankly, but no longer met the emphasis of the bank, and to develop new relationships in new priority areas. And I learned a whole heck of a lot from both ends of that assignment. And I believe it served as a great foundation for me as I subsequently went to work for not-for-profit hospitals and hospice providers.
Well, one of the privileges of this show, Mark, is just getting a deeper appreciation for your background and how you've woven it into this labor of love that you do now with Hospice News Today. So with that, you ready to jump in and list your top news stories of the month of May 2023?
Boy, I don't know. It's a crazy month, but we'll give it a try.
Yeah.
So, okay, my top 10 in terms of the amount of coverage that these areas received from the very end of April through most of May are long-term care, assisted living, senior living, number 1, physician-assisted suicide, medical aid and dying, number 2, merger and acquisition news, number 3, news of regional, national, for-profit providers, number 4, news about local hospice providers, number 5, labor and employment news, union news, number 6, news about physician and nursing issues, particularly nursing issues this past month. Number 7, number 8, news about end-of-life care, palliative care. Number 9, general news about hospice and the business of hospice. And 10th most popular category, news about hospitals, both revenues and earnings, as well as program cuts and facility closures. So with that, I'll jump into it. Long-term care, frankly, the coverage was all over the map. There was coverage of closures of some skilled nursing facilities. There were warnings, dire warnings about the impact of federal and state staffing mandates on nursing homes. There were some hopeful stories about occupancy trends continuing their upward recovery after COVID. But there was also coverage about states getting tougher on enforcing quality standards in nursing homes and reporters uncovering some really unsavory stories about lack of quality in nursing homes. No one particular story stood out from all that, but again, it says a lot of focus on nursing homes, and it's not necessarily a good focus if you're a nursing home operator. Second most popular story with 32 articles in the last month was physician-assisted suicide and medical aid in dying news. It's largely because state legislatures are continuing to deal with the issue, although the number of stories declined a bit because legislatures are starting to adjourn. The biggest news was the state of Vermont the legislature voted to allow out-of-staters to access Vermont's End-of-Life Options Act, and the Republican governor, Phil Scott, signed that legislation, so outsiders can now go to Vermont and try to comply with the regulations governing their aid in dying legislation. California also settled a lawsuit that was filed from physicians and other healthcare providers who are opposed to the California End-of-Life Options Act, mostly on religious grounds. And California agreed to settle the suit by agreeing that it cannot force physicians or others to help patients access the California End-of-Life Options Act. There was a warning sign in one article among the 32 this month, and that was from the San Diego Union Tribune. They looked at every local hospice in San Diego County, what they had on their website, and how they would respond to questions about their policies regarding the End-of-Life Options Act, and they found very little transparency from local providers in San Diego County. And the warning for hospices in states that have medical aid in dying legislation is that that type of story can be easily copycatted by reporters elsewhere in California or in other states. So it's been done once. At some point, I think we'll see it done again. Merger and acquisition news increased substantially in the month of May. I had 31 articles in Hospice News Today about M&A, and the articles fell into three tiers. The first tier was the very negative reaction to the rumors, and they're only rumors at this point, that Nashville's not-for-profit Alive Hospice, one of the largest, one of the oldest not-for-profit providers in the United States, and the only not-for-profit left in Middle Tennessee, that the board is considering selling it possibly to Amedisys. And coincidentally, the second tier of M&A articles last month was the announcement that Amedisys itself is being acquired by infusion services company Option Health. And the third tier of stories is just everything else, including the official couple stories about the official closing of the Chapters Health Capital Caring merger. Going back to the Amedisys Option Health story, that story generated a couple of comments, a couple of articles in the trade press by which folks said, okay, well, all this means is that Option Health has now set itself up to ultimately be an acquisition target by a managed care company. So if you worked for a company that Amedisys bought not too many years ago, you've gone through one owner, then Amedisys, then Option Health maybe, and who knows who else in the not too distant future after that. Is that the kind of life you want to lead? Staff are probably asking themselves. The next category was regional and national for-profit provider news, 32 articles, and the explanation is simple. It's earnings season. So everybody who's publicly traded has to put out a press release that details their quarterly results. That leads to a story the next day in which the leadership of the company engages with the financial analysts covering the company and journalists covering the company in a Q&A about those earnings. And then usually after the earnings releases, financial analysts hold 1 day, 2 day briefings for the healthcare sector for financial analysts, and everybody goes in and has 15 or 30 minutes in front of the analysts, and those briefings generate another story in the financial media and the trade press. which can sometimes drive not-for-profits a bit crazy because of all that coverage. Can also drive not-for-profits a bit crazy because the focus of that coverage is almost never on quality of care. It's on the metrics that are driving the business, profit margins, staffing ratios, how much they're making on routine home care versus how much they're making on inpatient care or continuous care. And to top it all off, Hospice News, the trade publication, ran a story not too long ago about four for-profits to watch in 2023. And those four, if you didn't see the story, were Amedisys, Optum, Guaranteed Hospice out of California, and St. Croix Hospice out of the Midwest, which has been opening a lot of de novos, along with a few acquisitions in recent years. The next category was general news about hospice providers, mostly not-for-profits, local providers. 22 stories in the last month. The articles were largely focused on openings and closings, new inpatient centers breaking ground or actually having ribbon cuttings, existing inpatient centers closing due to financial pressures, providers expanding into new markets, and that, of course, includes your own Telios Collaborative Network, Chris, which announced that it's welcoming hospice and palliative services of Northwest Kansas to the growing Telios family. Also worth noting, under the provider news category, two large not-for-profits open simulation labs that they're using for onboarding and training clinical staff. It's a story about investing for the future. It's an important leverage point for those not-for-profits that they ought to wield as they're competing against for-profits in their market area. It speaks to investing in training the next generation of hospice clinicians, and it speaks to expanding the pool of hospice workers at a time when everybody in the healthcare sector, from acute to post-acute, is hurting for employees. And speaking of employees, the next category was labor and employment news, 21 articles, hodgepodge of articles, no real consistent patterns as per previous months. Unionization activities, mostly at hospitals, but not exclusively at hospitals, as well as one story about an effort to decertify a hospital union. There were votes by unionized workers in hospitals to strike, mostly over staffing as opposed to pay and benefits issues. And there was an interesting article in which the SEIU, the largest healthcare union, went after one of the largest not-for-profit systems in the country, UPMC, accusing it of abusing its market power, not just in terms of its competitive power in the marketplace, but also in terms of the way it was treating its employees as well. Following that, physician and nursing news, 20 articles last month. Most of the focus was on nursing news and not physician news. Most of it was carryover from themes from previous months, particularly nurse burnout, staffing ratios, nurse shortages, and a few articles about scope of practice. There were a few more stories about the fraudulent nursing diploma mills in Florida, including one lengthy explainer from the Washington Post, which was a great how they did it article, in depth. It was headlined "Bogus Nurses, Fake Diplomas, Official Search for Unqualified Health Workers." If anything, an article like that can serve to put the story back in the national spotlight. Following that was coverage of end-of-life care and palliative care issues. Palliative care news increased over the month, if only because the sister publication, the new publication of the trade publication Hospice News, it's called the Palliative Care News, started publishing an article every day. Frankly, a lot of those articles were dredged up quotes and stories from events that have been held a week or two previous. There wasn't a whole lot earth-shattering or groundbreaking in most of that coverage, but it did raise the profile in general of palliative care news. There were a few noteworthy stories in the category, though. Most of them were columns by people talking about their end-of-life care experience from a physician. My stepfather was dying. Why wouldn't his doctors just say so? Or also a study about Asian Americans and end-of-life care Asian Americans being more likely to think about dying, but least likely to have an advanced care plan in place. And a story about more states integrating palliative care or thinking about integrating palliative care into their Medicaid programs. With 14 articles, general news about hospice, the hospice business was next. The bulk of those stories were about best employers. Modern Healthcare's Best Places to Work in Healthcare list came out with an abundance of providers in your home state of North Carolina on that list. There were a total of 10 hospices out of 150 companies total that made the list, or 10 hospice or hospice vendors, I should say. The 10 were Carolina Caring, in alphabetical order: Carolina Caring, Four Seasons, the Care You Trust, Hospice Home Care in Arkansas, Hospice of Rockingham County in North Carolina, Hospice of Stanley County in North Carolina, Nathan Adelson Hospice in Nevada, your parent company, Telios Collaborative Network in Flat Rock, North Carolina, Trella Health, a vendor out of Atlanta, and the VNA out of Terre Haute, Indiana. The other majors...
There was one more, Mark. Just so you know, there's one more too, CCWNC, which I know you can't tell by the name, but Compassionate Care Western North Carolina, which is also a TCN member.
Okay. Sorry, I missed that. Also worth noting was a very lengthy profile in a Saturday Wall Street Journal feature section about Tom Katsumpis, the head of MPHI and Capital Caring. Headline: Tom Katsumpis wants to ease the ordeal of dying. It's very rare when a hospice gets coverage like that in a national publication like the Journal. Last category was hospital news, 14 stories about hospital earnings, most of it generally bad news, although better news than when compared to a year ago. And then 24 stories about 10 stories about cuts at hospitals, program closures, hospitals closing, closing services, layoffs. Again, another not great month for hospitals in media coverage, which raises questions as to, how much hospitals need to pay attention to that. My honorable mention stories: there were 10 stories about grief and bereavement, pretty standard coverage. There were 9 stories about Medicare and Medicaid, almost all of them about Medicare Advantage, almost all of them negative for Medicare Advantage. Huge decline in the number of Medicare marijuana stories. There were 9. That reflects the fact that legislatures are adjourning and there's less and less action politically about medical marijuana. 7 stories about We Honor Veterans and veterans programs, obviously in a lead up to Memorial Day. 7 stories about visa and immigration solutions to the physician and nursing shortage issues. 6 stories about efforts to increase utilization and research into psilocybin and magic mushrooms. 5 stories about noteworthy individuals under hospice care. Well, there were tons of stories about Jimmy Carter, but 4 major stories. There was also an interesting story by Ashley Judd remarking on the 1-year anniversary of her mother, Naomi's suicide, and how she, Ashley, is still dealing with her grief and bereavement. 5 stories on death doulas, a couple of shots at hospice care in those stories, not as many as in some previous months. 3 stories about the problems and challenges facing rural health care and closures among rural health care providers. And then 2 stories that only had 2 two subjects that only have one story, but they were hugely important. Certificate of Need, Florida Tax Watch, a respected conservative group, came out with a study that said that Florida's CON program saves the state significant money and ensures significant increase in quality. And if you don't believe them, go look at the mess that is California, where there is no certificate of need. Represents a huge chasm between the Florida Tax Watch people, who are generally libertarian and generally anti-regulation and pro-tax reduction, and the libertarians who've been fighting to destroy the certificate of need regimen across the country. And then finally, one story on governance and transparency out of Colorado, but it was important. Colorado passed legislation to require not-for-profit hospitals to do a better job of detailing their community benefit. The question is, will they stop at hospitals, or will they go further into the healthcare sector at some point?
Thank you to our TCN Talks sponsor, Delta Care RX. Delta Care RX is also the title sponsor for our May and November 2023 Leadership Immersion courses. Delta Care RX is primarily known as a national hospice, PBM, and prescription mail order company. Delta Care RX is a premier vendor of TCN and provides not only pharmaceutical care, but also niche software innovations that save their customers time, stress, and money. Thank you, Delta Care RX, for all the great work you do in end-of-life and serious illness care.
Wow. Well, Mark, you always do an amazing job, and it's interesting always how there's so much parity. We just go at it just, very different ways. You do it from a quantitative standpoint. So you're going to see almost perfect overlay onto the ones that I'm going to choose. Before I jump in, one that I actually did miss was the Sim Labs. Do you remember the name of the two nonprofits that were doing the Sim Labs?
It was Tidewell in Florida, and it was the hospice in Grand Rapids, Michigan, for Michigan.
Great, good deal. I actually missed. Other than that, we had perfect parity on top. So I had 63 articles. As I go through each month, I'm like, okay, which are the ones that hospice leaders would want to know? So there are 63. I went ahead and grouped the vast majority of them into kind of 10 broad categories. The first category was the largest, which was about 20 articles, all related to staffing shortage. And the great thing that I'm starting to see now is more articles about potential solutions, none of which are easy because the immigration challenges. So that's the first category. We'll get into those in a second. Second category is related to President Carter and the fact that he's still, people just amazed that he's still with us 3 months later. And just the blessing that President Carter is being to the hospice and palliative care segment by being very overt and open about his journey. So that was the second category. Third category, and Mark, you nailed it. I actually wondered out loud to myself, but it was about home-based primary care, but as much so about palliative care. So a lot of palliative care articles. And I wondered to myself, is this because of the new publication? And I think you actually nailed that. The next category after that was something you alluded to, is some big trends related to healthcare systems. And so we'll come back to that. And then the fifth category, which were quite a bit of articles about Medicare Advantage. And as you said, not all of them positive. And then the sixth category was about that mergers and acquisitions, just like you had pointed out. Then the seventh category, there was several articles that I would just say added really good commentary about things like, for instance, Tom Kasumsa's article, Vicky Jingle was quoted in another article, and then the CON one. Eighth category was related to where CMS is going next on quality for hospice. That's a big deal for us. Ninth category was a Kaiser Health News study about the staggering toll on Black America and African American population and excess deaths. And then the 10th category I threw in there was modern healthcare best places to work, because we have such a vested interest in that. So let me kind of unpack so the first group, again, was staffing shortage. And so it goes from nursing shortfall is going to get worse as industry battles burnout. A lot of articles citing that about a third of nurses surveyed say they're going to be leaving the workforce. And so I know that the statistics are already pretty staggering without that third leaving. Concerns grow around U.S. healthcare workforce shortage. This was a CNN article. We don't have enough doctors. And then there were several articles about this one, nursing shortage from Bloomberg. Immigration can help solve the nursing shortage. Absolutely. And then there were several articles about that as well. Let's see here. A pause on visa applications is thwarting recruiting efforts. And then let's see here. How a green card freeze will exacerbate the nursing crisis. And then there was a really good article about how, and it was just, I felt it was a very bipartisan approach, basically saying, let's curtail what's going on at the border, but then actually let's have good immigration and really up the numbers of visas per year. And so that was I felt like a good balanced approach to, hey, we've got to do something about this. McKnight's home care article, home care must cater to younger workers, and really talking about how Generation Z and millennials and how we're going to have to cater to that generation to really help fill the roles of the number of shortages. And here it was the McKnight. So coalition of 400 plus groups calls on Congress to fix a broken immigration system. That's the one I was recalling a second ago, but it was the American Healthcare Association, Leading Age, American Seniors Housing Association, and more than 400 other national and state level business groups calling on Congress to enact measures to improve border security, update the legal immigration system, and take action on a bipartisan compromise to break the immigration reform gridlock. It's going to absolutely take something like that, or we're going to be in a whole world of hurt as we go forward. Another couple of interesting articles still in that same kind of grouping, but about 40,000 jobs or employment increase in the month of April in the senior living area. And then Mark, you alluded to this one as well, that, let's see here. Yes. Massive staffing mandate battle so nursing homes must prepare for massive staffing mandate battle, adapt to managed care mega trend. Nursing homes are past the COVID nightmare, but now are facing a real business problem that could be considerably worsened by the coming federal staffing mandates. So just talking about the challenge nursing homes are going to have to be able to comply with these staffing mandates admits already the actual staffing challenge. It's almost like saying, well, you guys need to staff up to a certain level, but then our legislators not doing the right things to make sure that we'll have the staff. And so here's another one, I forget what this was in, but it was titled H-1B Visa Shortfall Starves the Economy. Demand for labor has risen steadily since 2004, but the program is still capped at 85,000 per year. So to me, it's just putting a big highlight that we can't just keep kind of playing a political game with the whole immigration issue. We have some very macro issues, especially in healthcare, that we need our government to step up and figure out something and not just kind of play partisan games with each other. So that was all the first one. There were about 20 articles. Good, Mark.
I think something that gets coverage north of the border but not south of the border, meaning our northern border actually, is last year Canada admitted more people as a raw number than the United States did. Canada has 1/10 the population of the United States, and they admitted more immigrants.
Wow.
They have staffing shortages in healthcare and other industries too, but they're trying to deal with that by maintaining their tradition of a relatively free and easy immigration system.
So next category I alluded to was about President Carter. Again, 3 months into hospice, aware of many tributes coming his way and enjoying ice cream and his wife, Rosalind. So that was a great article. And there was another couple as well about just almost surprised that he is still in hospice, and we're not. This is the wonderful thing about hospice. So the next category, there were several articles about home-based primary care and palliative care. So CVS Health CEO will look at more home-based care deals in the long-term future. Home health providers adjusting operations to care for more clinically complex patients. Home health care news, the uptick in home-based primary care is a trend with staying power. And then New York Times, corporate giants buying up primary care practices at a rapid pace. And then 3 more specifically about palliative care. Palliative care can dramatically decrease cancer patient rehospitalizations. Palliative care news, Medicare Advantage crackdown could dampen palliative care growth. That wasn't exactly a positive, and it was actually a quote from Sanchez with Scan Health. I don't know if it was taken out of context, but basically said is Medicare Advantage is going to have to look at financial expenditures. But the whole point of the article is that might dampen Medicare Advantage providers providing a palliative care benefit. And many of us are trying to sit down at that table and actually position that. Palliative care providers have very positive incentive to contract with ACOs. I thought that was a great article. It feels like ACOs are kind of the next frontier for a lot of hospice and palliative care providers that are looking to get to payers and can't miss ACOs. Next category is about healthcare systems, Mark. And so healthcare systems moving into hospice and home-based care. And there was a quote specifically or citing about Kaiser. Now, Kaiser's actually consolidated its home health and hospice operations in California and Hawaii. Then modern healthcare cuts ahead. Health systems rethink non-clinical jobs. And right on the heels of that article from Modern Healthcare, Ochsner Health cut 770 jobs, which I think was about 2% of its workforce. Next category, still under that, about kind of just concerns about healthcare systems, but this was more in senior living. 7% of long-term care municipal bonds are in default. And the projected next year is that could go as high as 10%. So that was a little alarming. And then 200 residents were displaced via nursing homes in Cincinnati. And so I'm afraid that's going to be a trend that we're going to have to watch as we go forward. There's a lot of nursing homes with these staffing mandates that are already on the edge because of COVID. And then some of them that are backed by bonds. It's going to be really interesting to watch that. So the next category I had was all about Medicare Advantage. Dual eligible Medicare Advantage enrollees, including nursing homes, received worse clinical care. So talking about duals and how there's a study shows they got worse care. Couple articles about Humana CEO Bruce Broussard. We believe that home care offers a lot of opportunity for expansion. And then their CMO was quoted just talking about their expansion related to CenterWell. Then Kaiser Family Foundation, so KFF, half of all eligible Medicare beneficiaries are now in a Medicare Advantage plan. And then in Los Angeles Times article, Medicare Advantage was meant to curb federal healthcare spending, but it's actually costing more instead. And then McKnight's academics raised questions about MA plans' quality of care for those that are more seriously ill. And then the hidden costs home health providers face when taking on more Medicare Advantage. And I think that was all in that category. Then the next category, Mark, you called out, which was the mergers and acquisitions. Of course, the Medicis there with their Option Care Health $3.6 billion deal. And then I as well, obviously, the rumors about Alive and that for-profit potential that was part of the rumors was actually a Medicis. And you made a good comment about that earlier. And so there were 4 articles that jumped out to me that I just put in kind of a general category. There was Vicky Jingle with community healthcare in Texas. Unethical hospice practices is a heartbreaking disservice to patients. And Vicky was just citing just the proliferation they've seen in Texas, of course, Arizona, Nevada, and California. As some of that was shut down in Nevada, it kind of spilled over into California and then Arizona and Texas. And Vicky just citing some of the real challenges they've seen where the name of hospice has been sullied in that community. And then that CON report about the Sunshine State tops in high-quality hospice care. Thought that was a great article, Mark. There was an Investor Business Daily article about Cicely Saunders developed a new way to treat the terminally ill. That was a great article just kind of talking about Cicely Saunders as a very deliberate, action-oriented entrepreneur. I thought that was a great article. And then, of course, the article from the Wall Street Journal with Tom about wanting to ease the ordeal of dying and just talking about Tom's history. And then also how he's continuing to work to shape the future of the hospice benefit. And then there was a hospice news article about the HOPE tool, where CMS is going next on quality. That was a pretty important article for us hospice leaders. And then there's a Kaiser Health News study revealing the staggering toll of being Black in America, 1.6 million excess deaths over a 22-year period because of health disparities and health equity. And then my last on the list, number 10, was Modern Healthcare Best Places to Work. Mark, you cited all of them. So I think there are 11 hospices, and 6 out of those 11 are in the Telias family. So we're super proud of that because one of the things we talk about is the quadruple aim. is so important to the future, that we're working on better quality, better service, trying to get a better cost model or a lower cost model, and creating a great place for employees to work. And that's why that's such an important award. So those are my top 10. Again, a lot of parity to yours. And then here are kind of my honorable mentions kind of in this article. Most local hospices aren't transparent about their aid in dying policies. It's one reason why I appreciate what you do, Mark, because as a CEO, as a hospice CEO, I might want to go, you know what, let's not take a position on this medical aid in dying. But in a state like California, where there is a policy, you have to actually publish what your policies are. You can opt out, but you have to have a policy stating what it is. And so I can imagine some CEOs going to the Rotary Club or a VP of marketing or business development and then being asked that question, well, what is the position of your hospice on medical aid in dying? And that's one you probably don't want to be caught kind of cold on, that you want to actually have an answer that your organization has thought through. This was a Washington Post. Family caregiving should be seen as an expectation, not an exception. A great article. And just talking about the generation of millennials, anyone who's going to find themselves in a caregiving situation, and then also some interesting opportunities of what we could do as a nation to kind of codify the fact that caregiving is going to be an expectation as we go forward, as opposed to something it's almost like we're in denial about. Then CNBC News, the best and worst U.S. states for retirees based upon healthcare, wellness, safety, and more. It's a really great article. Let's see, actually, let me pull it up here. So the top states were New Mexico, Alaska. Let's see, nope, sorry, those are the worst. Looking at the wrong list. The best were Connecticut, Pennsylvania, Massachusetts, North Carolina, New Hampshire, Virginia, Minnesota, Ohio, Indiana, and Michigan. And then the worst were New Mexico, Alaska, Wyoming, West Virginia, Mississippi, Oklahoma, Vermont, Montana, Louisiana, and Kansas. So I thought that was a really interesting article, and it was related to healthcare. And then Washington Post, bogus nurse fake diplomas officials search for unqualified healthcare workers. And so, Mark, because you're alerting us to that, we actually had our network start looking through just to make sure, we didn't have any of those situations in our network. And then psilocybins, a nonprofit launches today to integrate psychedelic therapy with end-of-life care. So you accurately predicted we would be faced with that in the not too distant future. The human brain shows larger than life activity at the moment of death. And then, of course, the Denver Post article about Colorado's nonprofit hospitals to explain their community benefit in greater detail. And then virtual reality, modern healthcare, CMS may reimburse for virtual reality treatments. And then the last on my honorable mention, the person becomes a commodity. Funeral directors seek law to regulate body brokers. Gosh, we're living in Soylent Green today, Mark. So those are all of mine. Any comments to any of those, Mark, or any final thoughts?
It was a month with a huge divergent, a huge selection of stories, and I think it illustrates the need for hospice leaders, not just CEOs, but everybody in the C-suite and all of their one-downs and members of the board to scan the environment and know what has occurred, know what is occurring, and know what is likely to be coming down the road, because it's never going to slow down.
Wow, that's well said, Mark. And that probably leads us to our quote. So as we always do, we end with this quote. I ran this one by Mark. The ministry of the little things means that there are small things that may be less important to us, but the great, big, important items to others. That's by Juliana Goldenberg. So Mark, as always, thank you. You always make it a great educational learning show. And to all of you hospice and palliative care leaders, we really appreciate you listening. Thanks for listening to TCN Talks.